Did that ever happen to you that you were sleeping and in the middle of the night there was a severe leg cramp and the pain was so severe that your sleep was all over and it took about 5 to 10 minutes for you to get normal? If that has been happening to you more than once, then you should listen to this video. The thing is, the cramps or the leg cramps, they are so common that almost 10 million people each year suffer from them, even in USA. And the reason for that is that it can be due to neuropathy. That is, the nerves are relatively weak. The nerves have damaged external layer or the insulated layers. And due to that, just like a regular electric wire, if the rubber part is gone, then the wire is exposed to the external environment and it tends to cause short circuit, and there is increase or decrease of the flow of the current. And generally there is signal to the brain and the muscles which should not be there. Now the muscles have got an order that you should go into contraction. That should not have been ordered, right? So one of the reasons is neuropathy. The other reason may be that there is an external pressure that may be due to disc slip, that may be due to some other local compression, just like sciatica. One of the leading causes in the world is of neuropathy is diabetes mellitus, of course. So diabetes mellitus patients tend to have more of muscle cramps as compared to the other people in the same age bracket. Along with that, if there is a problem with the arterial supply of the muscles, in that case, let's suppose if there is peripheral arterial disease and due to any disease there isn't enough blood supply to the muscles, then there will be decreased nutrients that are available to the muscles. The muscle will be having a smaller reservoir as compared to a normal muscle. So even with the milder exertion during the day, during the night you will be having cramps. So you must be focusing on the cause if you are having repeated symptoms of muscle cramps. Another reason for that is that may be lack of electrolytes. The electrolytes most common that may be the cause of cramps are decrease in potassium, decrease in calcium, decrease in sodium, magnesium. And all of these electrolytes are available in so many nuts, vegetables, and even in your diet. So if you are having a good balanced diet, you should not be deficient in them. Another reason is the use of some drugs like diuretics. Diuretics are the drugs that take care of excess of water from the body, and they just make you pee more of water. With that pee, you may be excreting more of electrolytes like potassium and sodium, and that can lead to recurrent attacks of cramps. It's possible that you are using the muscles just too much, that you have been doing a lot of work that is not a usual routine for you. In that case, you may be having cramps in the night. Some diseases can also cause that, and a couple of diseases that can cause cramps are hypothyroidism, that is decreased level of thyroid hormone. In that condition, you have to use thyroid to maintain your life. And restless leg syndrome, as the name suggests, there is a lot of restlessness. The patient finds it hard to sleep during the night. He or she finds it better to walk. The restlessness tends to feel a little less when she or he is moving his lower limbs. But on the other hand, if the patient is lying still, the restlessness is literally unbearable. These patients tend to have more of cramps. The last part is cramps may be due to the lack of water. If you're not having sufficient hydration, then the cramps are a very normal consequence of dehydration. Now that brings me to the second part of the video, that how to treat these cramps without using any medication. And the last part of the first thing is hydration. If you're using sufficient amount of water, you won't be facing repeated cramps in the night. But if you are used to drinking less than what you should, in that case, there must be repeated attacks of cramps, and this is a signal from the body that you need more water. Along with that, magnesium-rich food is excellent for the people who are having repeated attacks of any kind of cramps. And the magnesium-rich food is avocado, nuts, almonds, spinach, and other electrolytes that contain a lot of potassium like banana and other fruits too. Once you're done with it, the additional thing that you should do is stretching. The stretching, when the cramp is there, it's not really easy to stretch, but the stretching does help. If you're able to do some stretch, there will be slight increase in pain, but gradually the pain and the cramps will go away once the stretching is there. If you're doing a stretching exercise during the daytime, there are less chances that you will be having cramps in the night or in any part of the day for that matter. One of the things that is really advocated these days is Epsom salt soak and the so-called foot soaks, in which there is Epsom salt put in water and then you put your foot in, and they tend to imbibe some of the magnesium, and in that way the muscles tend to feel better and there are less chances of cramps. The cold and the hot therapy, like the hot pads, they should be used, and if the repeated attacks of cramps are there, they can be applied to the part of the leg that is facing repeated attacks of cramps. But generally these hot therapies, they don't work that well in cramps because this is a temporary thing. It comes and goes, and by the time you will be arranging that hot pads, the cramps will be gone. Finally, if you have done the hydration, you have done the stretching, you improved your magnesium diet, you have talked to your physician, but if it's still there, probably you should change your footwear. Sometimes it so happens that we are using some kind of footwear that is not really meant for us, and in that case the muscles have to work really hard to maintain the posture and compensate for the faulty footwear. Please use a shoe that really suits you, and if you are unsure about if that's the cause, talk to your physician. Stay healthy, stay strong, stay informed. Thank you so much for tuning in.